It was maybe 2 years ago, this past summer, and I don't know, just something didn't sit right. I didn't really have an appetite, and I love food. Um, yeah, and just nothing really sat well. I could eat small bits and pieces, but big, large meals like before I couldn't really handle. I just didn't really have an appetite. So kind of just put off symptoms, kind of hoped it would go away. My sister, who's a nurse, suggested, maybe you go check it out, go to our primary care physician and see what he has to say about it. And he looked at me, kind of did an examination. Everything was normal from the outside because, I think I was 19 at the time, and 19-year-old kid in fairly decent shape, and couldn't really tell anything was wrong from the outside. So I kind of just waited it out a little bit. I went to a different primary care physician, and they referred me to a gastroenterologist who ended up doing kind of a scope of my esophagus and where my esophagus and stomach meet up. And he did notice that there was some kind of scarring or a little bit of redness, an abnormality, I guess, of the tissue down there. And so they put a capsule kind of at the base of my throat and gave me a little sensor to monitor acid levels. And I would press a button whenever I kind of felt pain or felt my symptoms coming back. And when I was eating and drinking and stuff like that, I would just kind of monitor the situation. The process that I was told was they take the top of the stomach and kind of wrap it around the esophagus, and then for me, because I had one side of the muscle that was a little bit thinner, they moved my esophagus up to kind of recreate the curve that's supposed to be in your stomach to kind of reduce acid levels going in and going up into your throat. Afterwards, it's pretty difficult to readjust your diet. Even simple foods, water was tough to swallow. I was put on a diet for about 6 to 8 weeks of strictly soft foods at the beginning, strictly like chicken broth, beef broth, cottage cheese, what have you. And because I was so young, the doctor kind of progressed me a little bit further along, a little bit quicker. So instead of 6 to 8 weeks, I was done with the diet in about 4 to 5 weeks. But as of then, I kind of slowly progressed off the pills that I was taking beforehand, and since early August, I hadn't had an episode or really hardly anything to complain about.